We all know antibiotics and their wonderful power to cure bacterial infections. Let's see what happens when we take antibiotics without DAV132. When we take antibiotics orally, the antibiotics travel to our stomach and then to our small intestine. In the small intestine, the antibiotic pill or tablet dissolves, and the active molecules get into the blood. That's what drug people call absorption. In the blood, the antibiotic then travels to the infection site and cures us. But part of the antibiotic is not absorbed and continues to travel through the small intestine and finally reaches the colon. When we receive antibiotics intravenously, the antibiotic is directly injected into the blood. Part of it is filtered in the liver and transferred to the gallbladder. Then it is re-injected into the small intestine with the bile, and ultimately, some antibiotic residues also reach the colon. Hence, with both oral and IV treatments, antibiotic residues finally reach the colon. The colon contains a very densely populated flora, consisting in more than 100 trillion bacteria. This normal flora acts like a functional organ of our body and is beneficial to our health. When antibiotic residues reach the colon, they kill the normal bacteria that live there. But a few antibiotic-resistant bacteria survive, as well as spores of the bacterium Clostridium difficile. As the flora is disrupted, Clostridium difficile or C. difficile spores germinate to give rise to mature bacteria which multiply and colonize the gut. Then, in some cases, C. difficile bacteria produce toxins which cause diarrhea that can be very severe and even needing surgery. This is a Clostridium difficile infection. Furthermore, C. difficile spores can disseminate in the environment. Other patients in the same hospital may become colonized and then infected. This is the most common pathway for C. difficile epidemics. According to the U.S. Center for Disease Control and Prevention, C. difficile infections are responsible for 500,000 infections and 15,000 deaths per year in the USA. And the total costs associated with C. difficile infections would exceed $4 billion. Now, how can DAV132 reduce the health and economic burden of C. difficile infections? Let's go back to the original colonic flora with no C. difficile colonization and infection. Now, we take DAV132 along with the antibiotics. Both reach our stomach and small intestine. The antibiotic pill starts to dissolve and releases the active principle, which is absorbed. Meanwhile, the DAV132 does not dissolve thanks to a special coating developed by Volterra. Consequently, no DAV132 is released in the higher part of the small intestine, and it does not interfere with the absorption of the antibiotic into the blood. Only when the DAV132 gets to the lowest part of the small intestine does it dissolve and release active DAV132 particles. In the colon, home of the colonic flora, antibiotics arrive along with DAV132 and are irreversibly captured by DAV132 particles before they have a chance to kill the normal bacteria. Hence, the normal flora is unharmed. The antibiotics bound to the DAV132 particles are evacuated in the stool with no alteration of the bacterial flora of the colon. Of course, this mechanism will also work if the antibiotic is received intravenously. The beneficial flora is protected, and C. difficile and other opportunist pathogens cannot colonize and develop. Clostridium difficile infections are prevented. DAV132 prevents the occurrence of Clostridium difficile infections by safeguarding the integrity of the colonic flora. DAV132 safeguards the integrity of the colonic flora.